We've just covered the first 4 powerful nutrients: vitamin D, calcium, vitamin B12, and magnesium, that play a vital role in keeping your legs strong, steady, and full of life. But we're not done yet. In Part 2, we'll dive into the remaining 3 vitamins that complete the ultimate leg strengthening plan. These final nutrients are just as important, and you won't want to miss how they work together to maximize your muscle function, bone health, and overall mobility. Let's start with the 5th powerful vitamin, potassium, the electrical muscle conductor. You might know potassium as the banana mineral, but its role in muscle strength and leg health is far more significant than most people realize. Potassium is one of your body's most important electrolytes. It keeps your muscles contracting, your nerves firing, and your heart beating at a steady rhythm. Without enough potassium, your legs can feel weak, shaky, crampy, or even completely drained of energy. If you've ever stood up and felt like your legs might buckle, potassium could be playing a role. What potassium actually does. Potassium works inside every cell in your body, especially muscle cells and nerve fibers, to maintain a precise electrical charge. This charge is what allows your nerves to send signals and your muscles to respond with smooth, coordinated contractions. For your legs specifically, potassium supports muscle contractions and prevents fatigue, prevents cramps by balancing sodium and fluid, keeps your heartbeat stable during movement, regulates fluid levels in muscle tissue, helps maintain normal blood pressure, which improves circulation to your legs. Without it, nerves misfire, muscles stiffen or spasm, and fatigue sets in quickly. Potassium deficiency, more common than you think. Most people assume they're getting enough potassium, but surprisingly, over 98% of adults don't meet the recommended intake. This is largely due to diets high in processed foods, which are low in potassium, and low in fresh fruits, vegetables, and whole foods. Older adults are particularly vulnerable to low potassium, hypokalemia, due to diuretic use, common in blood pressure and heart meds, low-calorie or low-carb diets, chronic dehydration, excessive sweating without replenishment, poor kidney function or digestive disorders, symptoms of low potassium, hypokalemia. In your legs, low potassium levels can cause noticeable symptoms in your legs and feet, sudden cramps during activity or rest, tired, heavy legs, even with mild exertion, tingling or numbness in the calves or feet, muscle spasms or twitching legs, giving out during stair climbing. Slow recovery after walking or exercise, severe deficiency can cause paralysis, but even mild hypokalemia can lead to falls, injuries, or leg pain. Real-life story. Lorraine's wobbly walk. Lorraine, age 70, noticed her legs would tremble after climbing stairs. At first, she thought it was fatigue, but her doctor found her potassium was just under 3.5 millimoles per liter, the low end of normal. Turns out her blood pressure pills, a type of thiazide diuretic, were flushing potassium from her system. With a dietary change and a daily potassium-rich smoothie, her legs regained strength and stability within 2 weeks. "I thought I needed to rest more," she said. "Turns out I just needed more bananas, sweet potatoes, and water." How much potassium do you need? The recommended adequate intake for adults is, women and men, 4,700 milligrams per day. Yet the average adult gets only about 2,500 to 3,000 milligrams per day, well below the ideal range. Unlike sodium, which is overconsumed, potassium is often underconsumed, yet essential for muscle, nerve, and cardiovascular health. Top potassium-rich foods for leg health: sweet potato, baked; avocado, spinach, cooked; banana, white beans, coconut water, salmon, baked; dried apricots, yogurt, plain, low fat. Tip: potassium is more concentrated in fresh, unprocessed foods. The more processed a food is, the more potassium it tends to lose. Sodium versus potassium. The electrolyte balance. Potassium's biggest rival, sodium. The typical Western diet is overloaded with sodium, from salt, packaged foods, etc., and lacking in potassium. This imbalance increases blood pressure, causes muscle dehydration, disrupts nerve signaling, triggers cramps and fatigue in your legs. By increasing your potassium and reducing excess sodium, you restore electrolyte balance, allowing your legs to perform better and recover faster. Should you take a potassium supplement? In most cases, potassium is best obtained from food. High-dose potassium supplements, above 100 milligrams, are regulated because too much potassium, especially in people with kidney issues, can lead to dangerous heart rhythms. That said, low-dose supplements, 99 milligrams, are available and may be useful for people who take potassium-depleting medications, sweat heavily during exercise, eat low-carb or low-calorie diets. Important: always consult your doctor before supplementing with potassium, especially if you have kidney disease, take ACE inhibitors or ARBs, or use diuretics. Hydration and potassium. Hand in hand, hydration is essential for maintaining electrolyte balance. When you sweat or lose fluids, you don't just lose water. You lose electrolytes, especially potassium and sodium. Replenish with water-rich, potassium-rich foods like fruit smoothies, vegetable soups, or coconut water. Hydrating properly improves muscle function, energy levels, and leg strength, especially in warm climates or during workouts. Potassium and blood pressure. A 2-for-1 win. Another lesser-known benefit of potassium is its positive impact on circulation. Potassium helps relax blood vessels, improving blood flow to your legs and reducing the risk of peripheral artery disease, PAD, leg swelling, and venous insufficiency. For people with high blood pressure, increasing potassium while reducing sodium can reduce leg heaviness, swelling, and fatigue. Signs your legs are getting enough potassium. You may notice fewer muscle cramps or spasms, improved endurance and stamina, more stable balance and leg control, reduced fatigue after walking, better blood pressure and circulation to the lower limbs. Final thoughts on potassium. Potassium acts like the spark plug in every leg movement you make. It maintains the electrical balance your muscles and nerves depend on to function smoothly. When you're low, your legs feel heavy, stiff, and prone to cramping. But when your levels are optimal, they feel energized, coordinated, and strong. So the next time your legs feel sluggish or shaky, ask yourself, am I giving them enough potassium to keep moving? 6. Vitamin K, the director for calcium placement. When it comes to maintaining strong bones and preventing calcium from causing harm, vitamin K plays a critical yet often overlooked role. Often called the director of calcium placement, vitamin K ensures that calcium is deposited in the right places, primarily in your bones and teeth, while preventing it from accumulating where it can cause damage, such as in your arteries or soft tissues. What is vitamin K? Vitamin K is a fat-soluble vitamin, meaning it dissolves in fats and oils and is stored in the body's fatty tissues. There are two main forms of vitamin K. K1, phylloquinone, which is found in green leafy vegetables like spinach, kale, and broccoli, and K2, menaquinone, which is found in fermented foods and is also produced by certain bacteria in the gut. The role of vitamin K in calcium metabolism. The magic of vitamin K lies in its ability to activate certain proteins that regulate calcium. Two key proteins stand out: osteocalcin. This protein is essential for binding calcium to the bone matrix. Without vitamin K, osteocalcin remains inactive and cannot perform this crucial function effectively, leading to weaker bones. Matrix glay protein, MGP. This protein helps prevent calcium from depositing in the arteries and other soft tissues, reducing the risk of arterial calcification and cardiovascular disease. In essence, vitamin K ensures that calcium strengthens your bones instead of clogging your arteries. This calcium-directing function is vital because calcium, while essential, can be harmful if misplaced. Vitamin K and bone health studies consistently show that adequate vitamin K intake correlates with better bone density and a lower risk of fractures, especially in older adults. One reason is vitamin K's involvement in the carboxylation of osteocalcin, which enhances the protein's ability to bind calcium and build a stronger bone matrix. In clinical trials, supplementation with vitamin K2, in particular, has demonstrated improved bone mineral density and reduced fracture rates in postmenopausal women, a group especially vulnerable to osteoporosis. Vitamin K and cardiovascular health. The benefits of vitamin K extend beyond bones. Arterial calcification is a major contributor to heart disease, and research has shown that vitamin K deficiency can accelerate this process. People with higher vitamin K intake generally have less arterial calcification and better cardiovascular outcomes. One large-scale study found that individuals with the highest intake of vitamin K2 had a significantly reduced risk of dying from heart disease compared to those with the lowest intake. How much vitamin K do you need? The recommended daily intake varies by age and sex, but adults typically need about 90 to 120 micrograms per day. However, because vitamin K is fat-soluble and stored in the body, deficiency is relatively rare, especially if your diet includes plenty of green vegetables or fermented foods like natto, sauerkraut, or certain cheeses. Signs of vitamin K deficiency. Although uncommon, vitamin K deficiency can occur in people with fat malabsorption disorders, those on long-term antibiotics, or individuals taking certain medications like blood thinners. Symptoms include easy bruising, bleeding gums, or excessive bleeding. Food sources. Rich in vitamin K, kale, spinach, broccoli, Brussels sprouts, lettuce, natto, fermented soybeans, cheese, egg yolks. Supplementation and safety. Vitamin K supplements, especially K2, are gaining popularity for bone and heart health support. They are generally safe, but if you're on blood-thinning medications such as warfarin, consult your healthcare provider before supplementing, as vitamin K can interfere with these drugs. Vitamin K2 versus K1. What's the difference? While both forms of vitamin K are essential, their functions and sources differ notably. Vitamin K1, phylloquinone. This is the form found mostly in green leafy vegetables. It primarily supports blood clotting functions in the liver. Although K1 contributes to bone health, it is less effective than K2 in directing calcium to the bones. Vitamin K2, menaquinone. This form is more active in extrahepatic tissues like bones and arteries. K2 comes in several subtypes, MK4 through MK13, with MK7 being the most studied for its long half-life and superior bioavailability. Vitamin K2 is mostly found in fermented foods and animal products. Research increasingly suggests that vitamin K2 is the crucial form for bone and cardiovascular health. It activates osteocalcin and matrix Glay protein more effectively than K1, thus playing a more vital role in preventing arterial calcification and boosting bone strength. How vitamin K works with other nutrients. Vitamin K doesn't act alone. It works synergistically with several other nutrients. Vitamin D increases calcium absorption from the gut, but needs vitamin K to ensure calcium is deposited properly in the bones. Without vitamin K, excess calcium may end up in the arteries or kidneys, contributing to calcification and stones. Calcium. Adequate calcium intake is essential, but without sufficient vitamin K, calcium may not be effectively utilized by the bones, reducing its benefits. Magnesium. This mineral activates vitamin D, helping regulate calcium metabolism. Magnesium deficiency can disrupt vitamin K's functions as well. Balancing these nutrients together is essential for optimal bone and cardiovascular health. Scientific evidence and studies. Numerous studies have highlighted the importance of vitamin K in health. Bone fracture prevention. A meta-analysis of randomized controlled trials published in the Osteoporosis International Journal found that vitamin K2 supplementation significantly reduced vertebral, hip, and non-vertebral fractures. Cardiovascular protection. The Rotterdam study, a landmark population-based cohort study, showed that high dietary intake of vitamin K2 was associated with a 57% reduction in severe aortic calcification and a 26% reduction in all-cause mortality. Bone mineral density. Clinical trials demonstrate that vitamin K2 improves bone mineral density in postmenopausal women who are at high risk for osteoporosis. Practical tips for boosting your vitamin K intake. Eat more greens, make leafy vegetables a daily staple. Spinach, kale, Swiss chard, collard greens, and broccoli are all excellent sources of vitamin K1. Incorporate fermented foods. Natto, a traditional Japanese fermented soybean dish, is one of the richest sources of vitamin K2, especially MK7. Other fermented foods like sauerkraut, kimchi, and certain aged cheeses also provide K2. Don't neglect animal products. Egg yolks, butter, liver, and other animal-based foods contain vitamin K2. Gut health matters. Since gut bacteria synthesize some vitamin K2, maintaining a healthy gut flora through probiotics and a fiber-rich diet indirectly supports vitamin K status. Who should pay extra attention? Certain groups are more prone to vitamin K deficiency or may benefit most from supplementation. People on long-term antibiotics, which can disrupt gut bacteria producing vitamin K2. Individuals with digestive disorders such as celiac disease, Crohn's disease, or cystic fibrosis that impair fat absorption. Elderly adults due to decreased dietary intake and absorption. People on blood-thinning medications like warfarin who need to balance vitamin K intake carefully. Potential risks and interactions. Vitamin K is generally safe even at high doses, but interactions with blood thinners are important to monitor. Patients on anticoagulant therapy should work closely with their doctors to manage vitamin K intake and avoid fluctuations that could affect medication effectiveness. Summary. Vitamin K may not get the spotlight like vitamin D or calcium, but its role as the director for calcium placement is absolutely vital. It ensures that calcium strengthens your bones while protecting your arteries from harmful calcification. For anyone serious about bone and cardiovascular health, Ensuring adequate vitamin K intake should be a key part of the nutrition plan. Number 7 is vitamin B6, the protein and nerve synergy booster, extended understanding. Vitamin B6, a vital player in muscle and nerve health. Vitamin B6, also known as pyridoxine, is one of the 8 B vitamins that play critical roles in cellular metabolism. It acts as a coenzyme in over 100 enzymatic reactions, many of which involve protein metabolism, neurotransmitter synthesis, and immune function. Because muscles are primarily made of protein and nerves control muscle movement, vitamin B6 stands at the crossroads of muscle strength and nerve function. How vitamin B6 supports muscle health protein is the building block of muscle, and vitamin B6 is essential for the breakdown, absorption, and utilization of amino acids, the individual components of proteins. Specifically, amino acid metabolism, vitamin B6 helps convert amino acids into neurotransmitters and other molecules necessary for muscle repair and growth. Without enough vitamin B6, the body can't efficiently use dietary protein for muscle maintenance. Glycogen breakdown. B6 supports enzymes that break down glycogen into glucose, providing energy during muscle exertion, especially in endurance activities. Hemoglobin production. Adequate B6 is vital for producing hemoglobin, the protein in red blood cells that carries oxygen to muscles. More oxygen means better muscle performance and faster recovery. Vitamin B6 and nervous system. Function, muscle strength depends not just on muscle mass, but also on the nervous system's ability to coordinate movement. Here's how vitamin B6 contributes. Neurotransmitter. Synthesis. Vitamin B6 helps produce key neurotransmitters such as serotonin, dopamine, GABA, and norepinephrine. These chemicals transmit signals between nerves and muscles, facilitating smooth and coordinated movement. Myelin sheath. Maintenance. B6 supports the formation of myelin, the protective coating around nerves that speeds up signal transmission. A healthy myelin sheath ensures nerves communicate effectively with muscles. Nerve repair and function. Deficiency in B6 can cause peripheral neuropathy, a condition characterized by tingling, numbness, or weakness in the limbs, reflecting compromised nerve function. Scientific insights. Studies on vitamin B6 and muscle, heart, nerve health. A study published in the American Journal of Clinical Nutrition showed that older adults with adequate vitamin B6 levels had better muscle function and physical performance compared to those with deficiency. Clinical research on patients with diabetic neuropathy found that B6 supplementation improved nerve conduction velocity and reduced symptoms like pain and numbness. Another trial demonstrated that vitamin B6 combined with other B vitamins helped reduce muscle soreness and enhanced recovery after intense exercise. Signs and symptoms of vitamin B6 deficiency. Vitamin B6 deficiency is relatively uncommon but can occur due to poor diet, certain medications, or health conditions. Symptoms related to muscle and nerve health include muscle weakness or cramps, tingling or numbness in hands and feet, irritability or mood changes due to neurotransmitter imbalance, confusion or difficulty concentrating, in severe cases, seizures or depression. Food sources rich in vitamin B6. The good news is that vitamin B6 is widely available in many foods, including poultry, chicken and turkey are excellent sources. Fish, salmon, tuna, and other fatty fish provide both B6 and omega-3 fatty acids. Starchy vegetables, potatoes and sweet potatoes offer substantial B6. Fruits, bananas, avocados, and watermelon. Legumes and nuts. Chickpeas, lentils, and pistachios are notable sources. whole grains, brown rice, and fortified cereals, maximizing vitamin B6 absorption and utilization. Balanced diet. Eating a variety of foods ensures you get not only B6, but complementary nutrients like magnesium and zinc, which support B6 function. Avoid excess alcohol. Alcohol interferes with B6 absorption and metabolism. Medications to watch. Certain drugs such as isoniazid, hydralazine, and penicillamine can deplete B6 levels, so supplementation may be necessary under medical supervision. Recommended daily intake and supplementation. The recommended dietary allowance, RDA, varies by age, sex, and life stage, but generally ranges from 1.3 to 2 milligrams per day for adults. While most people get enough from food, supplementation might be advised for people with increased needs, such as athletes, pregnant women, or those with certain medical conditions. Potential risks of excess. Vitamin B6. Although water-soluble vitamins are generally safe, excessive intake of vitamin B6 supplements over 100 milligrams daily can lead to nerve toxicity, causing numbness or difficulty walking. Always follow medical advice on dosage. Putting it all together, tips for supporting leg health. Diversify your plate. Incorporate a mix of fish, eggs, dairy or plant milks, leafy greens, legumes, nuts, seeds, and fortifying cereals into your daily meals. Practice safe sun exposure. Aim for daily 15 to 30-minute sun sessions on exposed arms or legs while being mindful of skin sensitivity or sunburn. Consider supplements wisely, especially for vitamin D, B12, or if diet is restricted, always under healthcare supervision. Exercise regularly, especially weight-bearing movement, walking, resistance bands, gentle strength training, heel lifts, or chair rises direct nutrients into bone and muscle tissue. Stay hydrated. Adequate water intake helps support potassium balance, nutrient transport, and overall muscle function. Monitor with blood tests. Regular checks for vitamin D, B12, and calcium via bone density scans or blood markers can help tailor supplementation accurately. Coordinate with medications. If you're on blood thinners, diuretics, antacids, or blood pressure drugs, talk to your provider before adjusting nutrient intake. Final thought. Strong legs are more than muscular power. They're powered by efficient communication, nutrient-rich bones, and smooth coordination. This combination of vitamin D, calcium, B12, magnesium, potassium, vitamin K, and B6 forms a holistic foundation to help maintain leg strength, balance, and mobility as we age. You deserve strength, confidence, and independence every day. Let's continue building toward that together. If you found this video helpful, please hit like. It really helps support our content and reach others who need it. Leave a comment below sharing your thoughts. Which vitamin surprised you most? Have you tried adjusting one of them? What's your next health goal? And of course, subscribe and turn on notifications so you never miss our weekly health tips and evidence-based insights.